Today, we're going to be talking to you about the benefits of Botox in dentistry.
Is FDA approved and has been around for cosmetic purposes for nearly 20 years. By relaxing the muscles can last anywhere from 4 to 6 months. Undoubtedly, the number one non-invasive procedure in 2022. The American Society of Plastic Surgeons states over 7.4 million people in the United States are receiving treatments largely due to its minimally invasive nature. The use of Botox in dentistry is expanding to treat dental conditions like high lip lines, temporomandibular joint disorder, bruxism, dentures that are no longer fitting, and more. Purified bacteria that freezes muscles. In doing so, minimize the appearance of lines and wrinkles caused by facial expressions.
Botox is offered by many healthcare providers, including some not so highly trained or non-professional in the maxillofacial area. Dentists and dental hygienists are true facial specialists because of their extensive training regarding facial structure and anatomy. Dr. Michael Skadron was quoted saying, "As a dentist, I'm very well trained in the musculature of anatomy of the face, and I feel no other doctor can give injections better than a qualified and experienced dentist." Since dentists and hygienists are already fully equipped and knowledgeable for procedures much more dangerous and riskier than Botox, this treatment is a great addition to a dental practice in order to meet patient needs. There has been an increase in the demand for cosmetic procedures, especially which are minimally invasive. Patients are increasingly concerned with the aesthetics of their dental restorations and their function. Cosmetic injections can be used to complement dental restorations and give patients a more visually pleasing result. The dental surgeon's experience with the anatomy and function of facial muscles is a valuable asset in the administration of Botox and other cosmetic injections. A dental professional has comprehensive knowledge of facial muscles and expression dynamics that has the ability to offer treatments in a completely painless manner.
So next, we're going to talk about patients with bruxism. This condition can affect adults and children, and patients may experience headaches, jaw pain, tooth pain, and of course, dental problems and implications. So bruxism is quite common, with more than 200,000 cases diagnosed yearly. Currently, it's been shown that botulinum toxin is an effective and wide variety of medical conditions and can be applied for therapeutic purposes. In recent years, there has been a growing trend in the use of this drug substance to control the muscular overactivity of bruxism. This study's objective was to use botulinum toxin type A rather than traditional methods by conducting a systematic review of randomized clinical trials published in the health sciences literature. Studies of bruxism patients were conducted where botulinum toxin A tests were performed on the masseter and temporal muscles, and the control group was given injections of saline as the placebo, or the use of traditional methods for the treatment of bruxism, such as occlusal splints, other medications, and cognitive behavioral therapy. These studies were showing that botulinum toxin A injections can reduce the frequency of bruxism episodes, decrease their pain levels, and decrease the occlusal force. And overall, it offers a superior efficacy in the treatment of bruxism compared to the other groups who were treated with a placebo or with traditional methods of treatment for bruxism.
And it can also improve gummy smile correction.
Wow.
So botulinum toxin injection is a simple, effective, and painless and conservative way to correct gummy smile and achieve high patient satisfaction. It can be used for subjects with excessive gingival display without invasive surgical procedures such as gingival surgery and crown lengthening. By relaxing the lip muscles, a lower, more aesthetic smile can be achieved in a less invasive manner. While the Botox treatments are temporary, it at least gives patients a more immediate and less aggressive treatment option. So another treatment modality of Botox could be the correction of temporomandibular disorder. Despite the effectiveness of pain medications, response to opioid therapy often is incomplete, with approximately 3/4 of patients suffering from persistent pain, according to the Journal of Pain and Symptom Management. Botox injections has therefore become an attractive choice as therapy in patients with myofascial TMD who do not achieve a complete response with conservative management and pharmacotherapy. The most commonly affected muscles are the temporalis muscle, masseter muscle, and lateral pterygoid muscles. Numerous studies have shown that Botox provides long-term relief of myofascial TMD by decreasing the intensity, frequency, and duration of recurrent episodes. One study reported on 46 patients with TMD treated with 150 units of Botox to the masseters and temporalis muscles. They found significant reductions in their subjective and objective pain scores, and all patients with restricted mouth opening had some degree of improved range of motion. In an open label study of roughly 100 patients with TMD, the senior author found a 70% response rate to a botulinum A toxin injection to the masseter, temporalis, and lateral pterygoid muscles. The response was defined as a 50% or greater reduction of subjective pain and/or frequency of pain.
Lastly, in addition to all of the medical and cosmetic benefits that Botox injections can offer, it can also be a cost-effective and profitable addition to any dental office, all while offering more for our patients and in return, happier patients, more patient retention. It's a win-win situation.
We need the Dental Board and Dental Hygiene Board of California to enhance the upward mobility of dentistry and expand our practices. What we need from the boards is acceptance in the advancement of our scope of practice.
With our educational backgrounds and expertise, dentists and dental hygienists should be able to provide Botox services for therapeutic as well as cosmetic purposes. After all, we are the masters of the head and neck, not just the teeth.